Hi, I'm Christina Bausch. I'm a physical therapist and pelvic floor specialist here at Rebound Physical Therapy. We are an outpatient clinic that's located in Topeka, Kansas. And today we're going to talk about pelvic pain and how physical therapy can help with that. So first, I just want to start out by showing you the model of the pelvis and kind of explain a little bit about what all is going on. So if we look at the pelvis, if you look at it from the front, you've got the pubic bone in the front, you turn it around, you've got the tailbone coming down in the back. And then if we look at it from the underside, you can see all of this pink down in the bottom, that's all muscles. So those are the muscles that are the support for your pelvic organs. And it also helps to provide stability for the pelvis itself. So what we want to think about is that when those muscles are at rest, they should be fairly relaxed. So if we thought about it like my arm muscle, so if my arm's just hanging here, if we were to measure it, there's a little bit of muscle activity going on, but there's not very much. When we get up and move or we're active, we want that muscle to be able to engage and work and provide support, but then once it's done, it should be able to go ahead and relax and shut off. And then when we want to either empty our bladder or have a bowel movement, we want that muscle to be able to go from that relaxed state to actually shut off even more. So it's going to relax even more, drop down, elongate, and let everything empty through. So what happens sometimes is that instead of those muscles being at that relaxed state at rest, for some people, those muscles may actually be holding some tension all the time. So if you kind of imagine it like your upper trap or your neck muscles, sometimes those muscles tense up and they might hold some tension in them all the time. So that same concept can happen in those pelvic floor muscles. So just like you might develop some trigger points or some knots up in your neck muscles, those muscles within the pelvis can develop trigger points or knots in them too. And that can lead to pain either when they are pressed on, or it can cause chronic pain that is just there all the time. So there's also other muscles that are involved. So there may be pain that's caused from those muscles within the pelvis. Sometimes there's also pain that's coming from other muscles too. So there's muscles that attach kind of around the brim of the pelvis here that go down across over to your hips. There's muscles in your low back, your abdomen, your hip flexors. All of those muscles could be a source of pain. And it may be the muscles, it may also be the fascia. Sometimes if there's a history of abdominal surgeries or other conditions that maybe create some scar tissue or some fascial restrictions, that can be a source of pain too. So when you come in for an evaluation, we're going to look at all those areas and try to kind of pinpoint what are the causes of your pain specifically. So it may be there's multiple causes and it's going to look different for each person. But part of the treatment plan will be helping to retrain those muscles to not hold that tension in them. So we'll help to reset that resting level back to that normal state. For a lot of people, they're holding tension and they don't even know, it just feels normal to them. So they don't even realize that they're holding extra tension. And it's hard too, when you're in pain, your body automatically wants to kind of guard and tense. So that's really common. So we can work on strategies to help with that. One strategy that is helpful in decreasing that tension in the muscles is to use some diaphragmatic breathing. So basically what that means is just breathing into your belly. So your belly expands as you breathe in and then relaxes as you breathe out. So that's just one basic technique that can kind of help to start that process of relaxing those muscles, but there's lots of other tools that we can use. And there's hands-on techniques that we'll use to help to get those muscles calm down at whatever rate you're comfortable with. So sometimes if you're in a lot of pain, we may start really slow to whatever you're able to tolerate. So if you are experiencing pain either in the pelvis or anywhere within the low back or hip area, just remember that sometimes that could be caused by pelvic floor dysfunction, and that is something that a physical therapist would be able to help you with that's specialized in pelvic floor therapy. So please just reach out to me. I'd be happy to sit down and talk with you about what's going on specifically, and we can put together a plan to help relieve your symptoms.